So shame is never a useful emotion, especially when it comes to drug use. So this video is not about me telling you not to do drugs, okay? You do you. But if you want to be more educated and informed with the decisions you do want to make, then I think this video can be helpful. So why do people use drugs in the first place? Well, look, drug use has been going on for centuries, and it's rarely just one thing. It's usually multifactorial. Yes, there tends to be some elements of peer pressure when you're a teenager experimenting in drugs, but there's usually more to that. Often, drugs are used as a form of coping, right? So that is having some kind of issue, whether it's really painful emotions, problematic relationships, memories of a time where you felt unsafe or were traumatized, and then using the drugs to avoid those painful experiences. This is considered a type of self-medicating in a way. You're trying to treat yourself. You're trying to treat your own pain with the substance. Another reason is escapism, right? When life is very difficult and you just want to have it all go away, getting high or intoxicated is a way to switch the world off. And something else I've noticed in teenagers is often if there's a difficult relationship or issues in control, drugs serve as this dependable relationship almost. It's something you can trust. You know it's going to be there for you and provide a kind of expected outcome, which might develop into an addiction or a dependency, especially if other relationships are unpredictable and unable to support you. So look, let's talk a bit about the treatment options available. And maybe now's not the right time for you to stop drugs, okay? That's a possibility, and I'm not forcing anyone to do anything they don't want to do. You do you. But it's still helpful to watch this part of the video so that you at least know what the options are in the future if you do want to change your habits. So I think a really good place to start is with a family doctor or GP. Talking to your GP, they can do an assessment and a diagnosis and direct you to services that can help you. If you don't feel ready to do face-to-face, if you go to Kids Helpline, and I know it says Kids Helpline, but they support people up to the age of 25, they have online chat and free phone calls, and they provide support for young people experiencing mental health troubles. So too does Headspace as well. And there's also the National Alcohol and Other Drugs Service, and they're all free. And for some of them, you can even remain confidential. So really useful services are out there. They want to help. They're full of people like me, who go to work wanting to help. I know it can be a bit intimidating, but we don't bite. We just want to help people who want to get better.